Hi, my name is Carolina Saavedra. I'm a staff attorney at the Public Health Law Center, and I work in commercial tobacco prevention program. Today, I will be presenting on youth purchase, use, and possession laws, why this punitive approach is counterproductive to the public health goals of reducing youth nicotine dependency and tobacco use, and how it undermines good public health policy. And I will provide an overview of alternative solutions. I want to note that while we will be talking about youth, which includes school-aged youth, this presentation will not focus on K through 12 policy. Rather, it will focus on state, municipal, and county laws that seek to punish youth for interacting with tobacco products, regardless of the setting. So please feel free, like Stephanie said, to send any questions you have as they occur to you throughout the presentation, and I'll do my best to answer them at the end, or we'll get back to you via email at some point. So just a few preliminary things as well. The Public Health Law Center, or PHLC, is located at Mitchell Hamlin School of Law in St. Paul, Minnesota, in the indigenous homelands of the Dakota people, also known as the Sioux Nation, where there is a resilient and thriving indigenous population working to reclaim and revitalize the land and to strengthen the community. We are made up of a dedicated team of attorneys, policy analysts, and support staff. We work nationwide on public health policies in the areas of commercial tobacco prevention, healthy eating, active living, and climate justice. So next slide. We provide free legal technical assistance to all communities, public health advocates, and other partners. We also publish widely on commercial tobacco control policy, and we offer trainings and webinars like this one. However, we do not give direct legal advice or provide legal representation, and we do not lobby. And next slide. We are also focused on partnering with communities and organizations to use the power of law in a way that addresses the social determinants of health and meets specific needs of all communities, especially those who unfairly bear a greater burden of health harms and other societal harms. Next slide. After all, equity is about giving people what they need, which includes understanding barriers, circumstances, and conditions in an equitable society. Something like your race, gender, or sexuality should not be predictive of your health or happiness or of your ability to thrive. Next slide. And last but not least, I want to note that when I talk, or anyone at PHLC, when we talk about tobacco products or tobacco, we are discussing industrial scale commercial tobacco products or commercial tobacco, and not traditional tobacco, which is and has been used religiously, medicinally, and ceremonially by many indigenous communities and tribal nations for centuries. And you can learn more about traditional tobacco by visiting keepitsacred.org. Next slide. All right, so let's dive in. PUP laws are those laws that penalize youth for buying, using, or having tobacco products if they are under 21 years old. These laws exist at the state and local level. Currently, most states and the District of Columbia have some form of PUP law in their statutes, and there may be there are many local jurisdictions also around the country, including, counties and municipalities, townships, that also have some sort of PUP law at their local ordinance, in their local ordinance codes. I want to note that PUP laws are not the same thing as minimum age of sales laws, like the federal Tobacco 21 law, for example, that was enacted in 2019 and prohibits retailers from selling tobacco products to minors under 21 years of age. Any penalties for violations of those minimum age of sales laws are placed on retailers who sell the products and not on the youth who purchase them. So that's the main difference between PUP laws and minimum age of sales laws. As of January of this year, 42 states have some kind of have a minimum age of sales law similar to the federal one. However, the majority of states also rely on PUP laws, and a few only have PUP laws and not minimum age of sales laws. Now, I want to note that federal law, of course, applies within all states. So even retailers in states that have not enacted their own statutes raising the age of sale to 21 must still abide by the federal law. Now, as opposed to minimum age of sales laws, PUP laws are specifically designed to penalize teens and young adults. The stated goal of these policies is to deter youth from using and becoming dependent on tobacco products. However, the stated goal of a policy is not always its actual impact. And once this becomes apparent, like it has been for some time with PUP laws, it is important to revisit the policy and to change track to an evidence-based approach. Now, for starters, the evidence tells us that punitive measures do not work and do not help youth overcome their addiction to nicotine. The World Health Organization has found little apparent relationship between the severity of sanctions and the prevalence or frequency of use of addictive substances. The U.S. Center for Disease Control agrees and notes that the most effective approaches for helping youth quit tobacco are counseling and education, or in other words, support and resources. Next slide. So why are PUP laws ineffective? So I want to start by acknowledging the problem that PUP laws purport to address, of course, which is the widespread use of tobacco products by youth. The most recent National Youth Tobacco Survey shows that 10% of school-age youth, or about 2.8 million youth nationwide, report using tobacco products. And that includes about 12.8% of high school students and 6.6% of middle school students. Now, this last figure for middle school is concerning because the tobacco use by middle school age kids has increased since 2022. Now, of all products, e-cigarettes or vapes are by far the most popular product for the 10th year in a row. Now, the root causes of this youth tobacco use problem are the tactics that the tobacco industry has finessed to maximize youth nicotine addiction. Because the brain is still developing until about age 25, youth and young adult exposure to nicotine can change brain chemistry, making youth a lot more susceptible to addiction. And the earlier the exposure, the greater the risk, of course, of addiction. So the tobacco companies, they know that if they can get teens and young adults hooked on nicotine, they will likely gain a customer for life. So the industry, for this reason, designs these products to have a high enough level of nicotine to achieve this result. The effects of nicotine also intensify with repeated exposure. So the more youth vape or use other tobacco products, the more likely they are to develop a dependence to these products, to nicotine. For example, there are generally 100 puffs for every milliliter of liquid in vapes. So a vape that contains 2 milliliters, a disposable one that contains 2 milliliters will have about 200 puffs in all, which can last anywhere from a couple of days to a couple of weeks, depending on how often it is used, how many puffs the young person takes each time. But on average, these devices tend to be finished in a matter of days. So as you can see from the images, these products are also designed to be visually attractive to youth, with sleek and eye-catching designs, and on top of all the ubiquitous marketing through the mediums most frequented by youth, including social media and through influencers. But they are also these products are also designed to smell and taste like the flavors that youth prefer. Roughly 9, based on the National Youth Tobacco Survey, roughly 9 out of 10 current school-age vape users prefer flavor vapes, with fruit flavors being the most popular, followed by candy, desserts, and other sweets, and mint and menthol as well. Now, when it comes to cigarettes, menthols are also preferred, while all flavors in tobacco products are problematic. The Center for Disease Control has data that shows people who smoke menthol cigarettes have a harder time quitting than those who smoke non-mentholated cigarettes. So we'll go to the next slide. All right, so among other predatory practices, the tobacco industry has long engaged in include aggressive targeted marketing toward Black, Brown, and LGBTQ communities, and in particular, the youth in those communities, by inundating them with tobacco product advertisement and promotions. For example, the industry for decades has incessantly marketed menthol cigarettes specifically to Black communities. The tobacco industry spends a considerable amount in these marketing efforts, roughly $9 billion every year on marketing and advertising is spent by the industry, including, for some of the advertising that is placed on site at stores. Well, there is also widespread access to these harmful products. So at the same time, there's all these different access points due to the proliferation of tobacco retailers in many communities, most of which tend to be located near schools, parks, beaches, shopping strips, and other facilities that are frequented by youth. Many corner or convenience stores that youth are likely to frequent for other reasons, like to look for snacks, for example, also serve tobacco products, which then increases that exposure and access to those products as well. And of course, adding to this, as I mentioned before, the advertising, the predatory marketing, design practices that we discussed, and the availability of a variety of inexpensive tobacco products like disposable vapes, little cigars, or just smaller items. You have the perfect storm for a relentless epidemic of nicotine addiction in our children. Having constant availability of tobacco products and constantly seeing imagery also disrupts attempts at quitting and facilitates and encourages tobacco use initiation, all of which help to drastically increase the rates of youth tobacco use. Next slide. Okay, so with that in mind, we should, focus on, the strategy. What are the strategies that are primarily employed by PUP laws in order to combat youth tobacco use, which, these are going to be essentially its penalties. So these penalties are going to vary by jurisdiction. At the state level, the majority of states criminalize PUP violations in some way or another. Some treat them similarly to traffic violations, like in Vermont. Other states categorize them as misdemeanors, like Michigan. Some states, like Washington, explicitly classify PUP violations as non-criminal civil infractions, although they do retain high monetary penalties. And then in several states, mandatory suspension of driver's licenses can also be imposed for, trying to purchase tobacco products, especially using a false ID. Now, many municipalities and counties across the country have their own PUP laws as well. They may these can also range from misdemeanors to infraction classifications, or maybe civil infractions for PUP violations, with varying degrees of penalties across jurisdictions. But PUP penalties are often, they often look like fines, which also usually include other monetary costs like court or administrative fees. And they can, sometimes even impose compelled unpaid labor, such as mandatory community service. In some states like Montana and West Virginia, these fines can be pretty hefty, reaching up to $250 per incident, particularly after repeated violations. Other states may also issue multiple hours of compelled community service. For example, Michigan can issue up to 48 hours per violation, especially for repeated offenses. And, because youth under 21 tend to have less disposable income, lower paying jobs, less job stability. These penalties have an outsized impact on them, which is, causes a lot of harms, which we'll go over soon. But the greatest burden of these penalties is going to be felt by youth from lower socioeconomic statuses, who are also the youth who are most likely to have been targeted by the tobacco industry's predatory practices, and by usually residing in communities that are saturated with tobacco retailers and other, tobacco access points. These laws also create a cascade of other negative impacts, like increased likelihood of negative encounters with law enforcement and subsequent ones as well, the establishment of a criminal record, as I mentioned, loss of driving privileges for undocumented youth or youth who have certain immigration statuses like DACA or temporary protected status. These infractions or misdemeanors can put their ability to maintain their lawful status or to obtain one in the future at risk. These are, of course, extremely draconian and excessive consequences to impose on a young person for simply having smoked a cigarette or used a vape. Next slide. So these punitive measures are simply just not a reasonable or fair outcome for youth. And that is kind of what makes them ineffective, especially when you factor in the targeted marketing that we talked about by the industry, the science of addiction and the developing brain, and the long-term negative consequences that are associated with interactions with the judicial system that can have lasting negative impacts on various aspects of a person's life and community. Including, increased risk of incarceration and loss of stability and support networks. So those punitive measures in this context essentially blame the victim and ignore the root of the problem that we went over just a few slides ago. They minimize or ignore the fact that the tobacco industry has deliberately targeted youth in a very calculated and predatory manner. Pouring billions with a B of dollars toward addicting youth to gain long-term customers. Because the industry has and continues to also target Black, Hispanic, Indigenous, LGBTQ communities, these punitive measures against youth also often result in inequitable enforcement of these laws based on race, sexual orientation, or socioeconomic status. And this is the case even if there was no implicit or explicit bias informing the decision-making process, which studies have shown that there is. Monetary penalties can also be, or excessive unpaid labor hours, of course, are also regressive and burden youth with less resources exponentially. And by using the criminal justice system, PUP laws also open the door to selective police enforcement against youth along those, racial, ethnic, and socioeconomic background. We know that there are significant equity concerns with criminal penalties. For instance, like racial profiling and discriminatory racial patterns are well documented in the enforcement of many crimes, especially lower level offenses. Youth that are overrepresented in these types of offenses have increased interactions with law enforcement, even if they don't necessarily, always have increased instances of violations. And they have a greater likelihood of introduction into the criminal justice system later on or having repeated encounters. And criminal sanctions can jeopardize a person's housing, social benefits, education, employment, and as I mentioned before, immigration status, and even their ability to drive. So they're, these are pretty huge and consequential harms for a behavior that has been very actively designed by an industry that seeks to profit off of it. So, while these, PUP laws maybe are not, the intention behind them may not be to, create these different harms. These harms are certainly a foreseeable consequence of PUP laws that should be avoided. Now, these harms that I mentioned, of course, also compound in the fact that they lead to marginalization and stress, which in turn can lead to greater use of these, tobacco products that a young person might be addicted to, which further entrenches that addiction. And, young people who are experiencing nicotine dependency are in greater need of support and resources. But instead of providing that, PUP laws take away that support and the resources that they may have had to begin with. Next slide. So, to sum up, punitive measures just don't work. They don't help youth overcome their addiction to nicotine. Instead, another negative impact that they have is that they take the focus away from effective tobacco prevention strategies and divert resources away from those efforts. So, at the same time, doing nothing to get to the root of the problem, which is the industry manufactured nicotine dependency. And this slide just kind of has a bit of a summary. So let's go on to the next one. Instead again of getting to the root of the problem and addressing industry malfeasance, PUP laws generally tend to let the tobacco industry completely off the hook, shielding them from any accountability for the harm to our youth, which then enables them to continue and further entrench those predatory practices in the first place. Next slide. So now we can transition to discussing what are some real solutions that can help reduce youth tobacco use initiation and actually encourage cessation. So, this is going to be an overview, and this slide is just an overview, but we'll review some of these strategies a little bit more closely in the next few slides. But first, I just want to briefly go over some of the potential legal constraints. Essentially, for different jurisdictions, the type of policy measures that, a state or a local government can implement are going to depend on the extent of their legislative and regulatory power, and whether any higher level of government has placed any further constraints on those. Next slide. State governments generally have broad authority, to implement tobacco prevention measures through their legislative powers, which they derive directly from the people. While there may be some concerns at times that the tobacco industry may challenge a particular law by claiming that, federal law constraints or preempts state authority. For example, we've seen that a lot with point of sale restrictions measures. There is sufficient precedent to show that states themselves do have ample regulatory authority to pursue them. And, with courts having specifically upheld various point of sale restrictions, the examples on the slide basically show, flavor and pricing type of point of sale restrictions. These examples on the slide also have some, different court cases that have been favorable to tobacco prevention efforts in different states and in different federal federal circuit courts. Some of them at the circuit court level, some of them at the district court level, that have upheld these types of point of sale restrictions. Now, local governments such as cities and counties, they, unlike states, they derive the regulatory authority from the respective state constitution and legislature. Some states have restricted the types of tobacco prevention regulation that the localities can enact, and therefore each county or municipal agency that seeks to propose a particular policy or adopt a particular policy, especially the ones that we're suggesting, should consult a local council on what may be permissible under their particular state law. Generally, in states that provide ample local authority to regulate tobacco products, those local jurisdictions may also seek to adopt their own more protective measures, point of sale measures, than what their state has done, as long as they have that authority. In the Public Health Law Center, we welcome requests for technical assistance with legal research or best practices models, which we can share for educational purposes only. So next slide. So step one in these solutions, of course, is going to be undoing the harm of these counterproductive PUP laws, which is going to be to get rid of them. State legislatures can go all the way by completely eliminating PUP provisions from their statutes and adopting protective language that may potentially restrict their localities from enacting local PUP penalties. So in a way, using preemption for good. On the screen, there are a few examples of states that have done just that, although to varying degrees. Minnesota, for example, used to classify PUP penalties for use, purchase, or possession as misdemeanors, like Michigan. But Minnesota eliminated those PUP penalty provisions largely in 2020, although they did retain some penalties for using a false ID. While local jurisdictions do lack the local jurisdictions unfortunately do not have the authority to eliminate some statutory, state level PUP provisions or penalties, so they're kind of bound by them if they are dictated by state statute. But local jurisdictions do have ample authority under their police power to amend their own ordinance codes and remove those local penalties that they may have. And I do want to highlight that for local jurisdictions, that even if a local ordinance doesn't contain an explicit criminal or infraction penalty for a particular policy, that doesn't mean that penalties couldn't still, that those types of penalties couldn't still attach, because it is common for local codes of ordinances or county codes of ordinances to contain general default penalties for violations of any provision. So it'll be very important to take a look at your Code of General Penalties chapter and then go from there. Next slide. So effective alternative strategies are going to focus on holding the tobacco industry accountable, starting by enforcing existing laws that prohibit the sale of tobacco products to youth under 21 and require age verification. The federal government, of course, as I mentioned, already prohibits retailers from selling to minors, and many states have also enacted their own minimum age of sales laws. It is a good idea for states to have, their own, even if there is a federal one, in order to facilitate local implementation and enforcement within their state. And even for states that have enacted their own minimum age of sales laws, localities may want to also enact their own local minimum age of sales laws ordinances, which in some cases can, maybe even be stricter than the states. For example, localities can may be able to require ID checks for every customer who is going to purchase tobacco products instead of only for those who look like teens. And also, the ability to draft your own policy will usually provide greater latitude for implementing a system for conducting local comprehensive compliance checks, and ideally, hopefully use youth decoys to check that those minimum age of sales laws are being followed. Now, best practices for implementing and enforcing these laws at the local level and some of the point-of-sale policies that we will discuss in the next few slides are going to be to do so through a tobacco retailer license requirement, or TRL. I won't get into TRLs right now, but you can check out ample materials on TRLs on our website and how they work and everything that you can do with them. Next slide. Other effective strategies are going to be to restrict the sale of the very products that the industry has designed to be attractive to youth, like vapes or flavored products of all kinds. Now, all states have the authority to do this, but localities sometimes can be preempted depending on the relevant state statutes. And so that may require some legal research and analysis. Now, currently 8 states prohibit the sale of at least some type of tobacco product. Those are California, Maine, Maryland, Massachusetts, New Jersey, New York, Rhode Island, and Utah. I have included on this slide a hyperlink to PHLC's nationwide scan of jurisdictions that currently restrict the sale of flavored tobacco products. This resource describes those flavor restriction policies for varied jurisdictions throughout the country, including municipalities and counties throughout various states in the country, and of course describes those state-wide bans as well. Next slide. Another way to, there's so many different tools to be able to, reduce and assist youth in not starting to use tobacco products, and also to encourage cessation. So another one is going to be to reduce those access points that I was talking about, those tobacco retailers, and the accompanying advertising that usually goes along with them. So this can be done by limiting the total number of tobacco retailers in a particular jurisdiction, usually at the local level, or by limiting tobacco retailers' proximity to areas that are frequented by youth or to other retailers in order to avoid saturation. For example, San Francisco and New York have both adopted retailer density restriction formulas to limit the number of tobacco retailers that can operate within each district in the city. Because they're such large cities, they have many different districts, and they're able to in order to not ensure that the total number of retailers that is allowed in citywide concentrates near neighborhoods that are already hyper targeted by the industry, then they kind of split it up among districts, and then the limit is for the district as a whole, which is a more equitable way of doing that for a very large area. And for examples of proximity restrictions, restrictions, we also have DC, the District of Columbia, that bans the sale of vapes within a quarter mile of a middle school or high school. New Orleans prohibits tobacco retailers for being located within 300 feet of any school or park, public library, childcare facility, or church. And Chicago bans tobacco and vape shops from being placed within 1,000 feet or other tobacco and vape shops, or within 500 feet of any secondary school. And the map on the screen I included it kind of shows like a half-mile square census tract in a community in Los Angeles. And that's the red outline. All those gray dots that you see on the screen are tobacco retailers, which, as you can see, are all fairly close to each other, right? This is like a half a mile altogether. And they are also within walking distance of a school that is just outside those red borders. And then you can see a park that is not much farther, that is also surrounded by its own little gray dots. So this is just to illustrate, the saturation, the children who live in these neighborhoods, for example, or the youth who live in these neighborhoods, either visit or walk past that many retailers when they're just going around about their day, or if they're trying to visit a convenience store that may also be a tobacco retailer. So in the slide, I have also included a link to the Aspire Center's interactive tobacco retailer density map, which I believe covers most jurisdictions around the country. And so you can get an idea of is this something that, our jurisdiction maybe needs to do and kind of try to reduce the amount of access points to these tobacco products so that we can keep our youth safe. Next slide. Now, the tobacco industry also knows that young people are extremely price sensitive, and so they spend, as I mentioned earlier, considerably to ensure that they keep the prices down. And this is, while it sounds, counter to what the industry would want to do by making as much money as possible, it is really seen by them as an investment in getting lifelong customers. So, for example, in 2020, tobacco companies spent the majority of their, sorry, my dog is barking, the majority of their cigarette marketing budgets on price discounting strategies. It accounted for roughly 90% of their budget advertising and promotional expenditures. And so for this reason, setting minimum price requirements through various means is going to be a good way to limit the accessibility of these products to youth. And I do want to give a shout out to the city of Minneapolis, which earlier this year set a minimum price for a pack of cigarettes to $15, which is the highest in the nation. And it also banned price discounts and coupons for tobacco products. And the city estimates that the new minimum price is going to reduce the city smoking rate from approximately 15% to under 10%. Other jurisdictions around the country also impose minimum price restrictions on other tobacco products as well, particularly those that are most attractive to youth. San Diego County has a different schedule for minimum pricing for many different types of products. $10 per pack for cigarettes, and also little cigars. Cigars, minimum price of $5 per cigar, and then e-cigarettes. I don't believe this includes disposable e-cigarettes, but kind of start at $20 per device, and the starter kits for e-cigarettes at $30, which comes with additional e-liquid cartridges. So kind of keeping those prices up, because again, young people are very price sensitive, and so that's another way to kind of limit how much they may be willing to. The more expensive it is, the harder it is to get these products, and hopefully the less likely it is that they will use them. And we do have a more in-depth discussion of strategies to raise minimum price in different jurisdictions on a recent webinar we did back a few months before, so you can check that out on our website as well. Next slide. So just to wrap up, because I do realize we're running a little bit long, I want to go over the last two main strategies that I'm highlighting today, which is investing in cessation and also going to be education. So this slide is for investing in cessation, which is really kind of the core of what needs to happen if you are trying to really help youth who are, or anyone who is, has a nicotine dependency, to actually be able to stop using it, right? It is not really a voluntary behavior when you physically can't, your brain is craving that type of chemical. So investing in cessation resources to ensure that they are accessible to the community members who need them most is going to also be the most equitable way to reduce tobacco use among youth who are already addicted, right? So instead of penalizing them and kind of ruining their lives, you can, invest in or divert those costs that PUP laws incur into ensuring that you can connect them with the support and resources they need to be able to get better. So while all states have quitline services, which of course the information should be provided to youth, some youth will need additional support and treatment. Some need, will need medical treatment. And that's not always available. Some quitlines do offer some free cessation medications, at least for youth that are 18 years old or older. Unfortunately, there are no FDA-approved nicotine replacement therapies for anyone who is younger than 18, although I will note that in other countries they have done this. In Australia, for example, they generally allow nicotine replacement therapies for anyone who is over 12 years old. And so, for example, Alaska's tobacco quitline says that it provides cessation coaching via phone and online platforms, but also free FDA-approved over-the-counter nicotine replacement therapies like patches, lozenges, and gum. And in Delaware, eligible individuals can obtain free FDA-approved cessation pill therapies and nasal sprays. Now, increased investment is going to be needed because what the resources that these quitlines have are not always enough to be able to meet the need. Especially for communities that need it the most, like rural communities that have a harder time getting access to these services. So another way to kind of increase assistance is, for states to consider looking into adopting Medicaid expansion so they can cover a greater amount of people, and also look into adopting any state plan amendments that can provide coverage for nicotine cessation therapies so that they can ensure that those are affordable for people who can access that treatment. So research does show that gaining insurance coverage also just generally increases the odds of quitting smoking due to having more primary care visits, more follow-up and smoking assessments, and access to those medications. And of course, when funds are tight, again, jurisdictions should seek to partner with local and national cessation support groups or tobacco prevention groups. And some of them have a variety of self-guided or counseling online courses for youth, and I've included a couple of links there. Next slide. So finally, to ensure that I allow at least a couple of minutes, I'll just briefly go over consumer education. That is something that doesn't necessarily, it shouldn't require an ordinance enactment for a local jurisdiction to be able to pursue this tactic, but it can really empower youth by giving them the information that they have to make the choice to avoid tobacco products to begin with, or to become motivated to quit. And for this, I do want to highlight that youth tend to be a lot more preoccupied with environmental concerns and environmental justice concerns, and so highlighting the fact that a lot of these products are hazardous waste or acute hazardous waste, and then showing them the impact that they have and how they proliferate everywhere, including waterways. They get polluting the soil, leaching everywhere, and how there aren't, we don't have currently a very good way of dealing with this type of hazardous waste, particularly vapes, even when they end up in the facilities that they're supposed to go to, oftentimes they just end up being incinerated, which creates its own, additional pollution that impacts usually communities that have less resources. So just kind of raising that awareness of health and environmental impacts of tobacco can appeal to that sense that youth have of caring about environmental concerns, and might be effective in getting them to adapt their behavior. And of course, partnering with local organizations that can provide that, like Truth Initiative, the American Lung Association, Tobacco Free Teens, etc., can act as a resource multiplier for these local education efforts. And I realized that, I haven't left entirely a lot of time. We can, just kind of go through the next slide. The next slide is kind of just a framing slide. So, just read it in your own time. Basically, what is the policy of the goal? Youth who use tobacco products, they need awareness and support, and PUP laws don't do that. So find a policy that does. And the next couple of slides just have a few different resources that are kind of on point, more resources on PUP, and then the next one is for K through 12 schools, if anyone is interested in that specifically, since we did not go into any of that today. And finally, I think I can stay a few more minutes for additional questions, since I realized that I did run a bit long.
No problem. And yes, if you have to go, please, but we'll stay on for a couple extra minutes to answer a few questions here. One question we got in the chat, Carolina, and thank you very much for the presentation today, is talking about research and source material that can be shared with policymakers when relaying the inequities of perpetuated, the inequities perpetuated by PUP penalties. And before Carolina, I'll just also emphasize we'll try to share some of these resources online.
Yeah, so one of the resources that we published a few months ago on PUP specifically does have a few links to that in the endnotes. But if you want additional or maybe more tailored, maybe we can help find some of that for you as well. Just reach out to us by email and we can go from there. And then I see a couple more questions. One says Texas has charged thousands, maybe hundreds of thousands of youth with possession. But to my knowledge, no retailer has ever lost their tobacco sales license. Is there any state that actually has revoked tobacco retail sales licenses for selling to minors? So yes, there are states who have revoked licenses for violations of their minimum age of sales and violations of other types of tobacco prevention laws. I do a lot of work with California, and I know that in California, both the state and also local governments do use suspension of licenses, and then as a last resort, revocation of licenses, and that is written into their ordinances. The main thing is that if having the language is great, but ensuring that you also have the enforcement resources to be able to conduct frequent compliance checks and use some of these youth decoys so that you can assess, right, how which retailers are at fault. Because clearly from the numbers that you're saying in Texas, there's definitely a lot of retailers selling these products to youth, but the state unfortunately has focused primarily on penalizing youth as opposed to dealing with the actual source of the problem. So feel free to reach out to us if you would like to continue that conversation or come up with some ideas. But yes, I also know that there might be some there may not always be a lot of leeway for local jurisdictions, depending on their state, to be able to kind of change how they go about doing these things. I'm not super familiar with like the landscape of preemption in Texas, but it's certainly something we could try to look into if you would like. And finally, in states with PUP laws, do you know where these violations are often given? Are the stores with the products are purchased at schools? So I think it can happen at different places. It can happen at the stores if they happen to be caught there. It can also happen, if like there's a report or youth are found, carrying or utilizing these products, and they ask, for their age. It can really happen in any setting. But from what I know, it is possible that it can happen with schools. It would be nice for schools K through 12 policy to not involve police, but a lot of schools, of course, use school resource officers who a lot of times, are or most likely are local, belong to the local police department. And so they do have the authority to also make those charges at school settings as well.
Okay. Well, thank you very much. And thank you for all who stayed on for our Q&A. Again, if you have any further or detailed questions about a specific state or where you live, please feel free to reach out to us, the Public Health Law Center. You will receive an email with the archived webinar link. We'll include some additional resources. On that link, I'll have the webinar recording, the slides, then the resources we discussed today. But otherwise, have a wonderful rest of your afternoon. Carolina, thank you so much for your presentation, and have a great rest of your day, everyone.
Wonderful. Thank you, everyone.